Hi, today I will be speaking to you about migraine. This is one that a lot of people suffer from, and sometimes we don't even know what is going on. So 18% of women and 6% of men have migraines, which are specific neurological condition. It's a clinical diagnosis, which is a headache disorder. You need two groups of symptoms, which are moderately severe, mild headaches. You have symptoms like throbbing and pounding, as opposed to constant squeezing headache. Headaches that are worse with exhaustion. Headaches that are on one side of the head. If you have two of those, you meet the top criteria for migraine. The bottom criteria include nausea or vomiting, and the second one is light, sound sensitivity, and smell sensitivity. If you have two of the top and one criteria at the bottom, either nausea or vomiting, light plus sound sensitivity, you are considered to have migraine. Migraine is a diagnosis based on symptoms. Migraine is not specifically inheritable. It is polygenetic. It will often run in your family. You need to have 5 or more episodes of migraine that fit the symptoms I mentioned earlier. And they need to last for between 4 to 72 hours of headaches that are shorter, or longer lived. These symptoms would last between 44 to 72 hours. During this time frame, so it's not misunderstood for other types of headaches that are shorter or longer lived. If this is all you have, which is way more than enough to disrupt your life, then you have migraine with or without aura. 30% of people have migraine with aura. So there's migraine with aura and there's migraine without. So 30% of people have migraine with aura. And migraine with aura is a worse disease. It is comorbid with a lot of other things. So there's more risk of heart attack and stroke in the back of the brain. 2 to 10 times as much bipolar illness and depression, but also comorbid with other diseases like restless leg syndrome and irritable bowel disease. Migraines with aura tend to come on between, in boys, it tends to come on first, usually at the age of 4 and 8. And for girls, it comes on between the age of 8. It tends to come on, for boys, it comes on between the age of 4 to 9. And for girls, it tends to come on between the age of 6 or 10 before they start their cycle and start hormonal related things. Migraine without aura tends to be hormone related. It comes in women when they start having their cycle. It is hormone dependent and may get better in pregnancy and worse in menopause and after menopause. It tends to go away after menopause. It still has comorbidity. It might have twice as much anxiety disorder or bipolar. Some more depression. Migraine with aura, you can tell you are getting it. One thing that can make migraine go from an occasional problem to a continuous problem is what is called overuse of medication. So people who tend to overuse medication tend to experience this. Some of today's medication may cause tomorrow's headache. So there is rarely any medication that we take long term that doesn't have future consequence on our health, like metformin and statin medication for cholesterol. Migraine is not a blood vessel problem or the root cause. The root cause is the oversensitivity of some of the nervous system, specifically glutamine system, which is an excitatory neurotransmitter. It's a slow wave spreading depression that starts at the back of the head to the front. People who experience what I'm describing know exactly what I'm talking about. There are different types of aura. You could have visual, linguistic, which means it affects your sight, your ability to see, the way you speak, your motor skills, and there's also sensory aura. They tend to come on an hour before a migraine and go away. You need to have the underlying genetics to get migraine. And there are other root causes that would activate those genes to cause those problems. And I need you to know that you can actually change the way your genes express themselves. Okay, the fact that your parents had something does not necessarily mean you're going to get it, especially if there are lifestyle health issues. There is absolutely something you can do to improve the way you feel or to reduce the tendency of you having to go through the same level of health issues that they went through, especially when it comes to things like diabetes. The root cause can range from stress, disrupted cortisol balance. Poor sleep is a huge one. I always talk about sleep. The benefit of sleep is underestimated. If not fixed, the migraine won't go away. Inflammation is another cause. If you haven't listened to my audio on inflammation on YouTube, please check it out and listen to what I'm trying to explain there. So inflammation is another root cause. Food allergy is another one. Whenever you're not able to eat certain kinds of food, something is not right and you need to sort it out. We should be able to tolerate most good food, especially if it's real food and whole food. We should be able to tolerate it. So if you're in a situation where you're having to select certain food because they cause you digestive issue, the root cause is a gut problem. It is not the food that is bad. It is you probably have a leaky gut or you have some digestive issues that need to be resolved. And once you heal your gut, you'll be surprised at how much food you're able to tolerate. A healthy person is actually somebody who's able to eat a variety of food without any issues or without any health issues. Okay, so limiting the kinds of food you're able to eat is not a sign of optimal health. So I did talk about inflammation and allergies, food allergies, sensitivity or chronic infection or inflammatory processes all can push one to migraine. Vitamins and mineral deficiencies like B12, B6, B2 and magnesium, okay, it will quiet down over transmission and over excitability of the nervous system. So we absolutely need these vitamins and minerals. We also need movement. I love to call it movement because people are usually put off when you say exercise. So movement, slowly introducing them without going too hard on yourself to prevent the increase of cortisol level. As good as exercise is for us, it also can cause our stress level to go up, or the stress hormone cortisol to go up. So we need to introduce exercise in such a way that it doesn't cause the body that is already stressed even more stress. Hydration is another one. Hydration will improve symptoms of migraine. It is not usually the red wine that has pushed you off the edge or caused you to have migraine. Something has already kept you, things have kept you on the edge, and what's it called? Red wine may just have pushed you over that edge. Okay, it did not bring you to the cliff. Okay, it may have pushed you off the edge, but it didn't bring you to that cliff. So it's always good to go find the root cause of the problem. I'll give you an example. If your kitchen sink was blocked, you don't go scooping the water that is pouring down on the floor. You try to unblock the sink to have what's it called, to have the water, to get the water to go through the pipes instead of flooding your kitchen. So we always need to find what the root cause is to resolve the problem. It is not usually, so we also need to build our body's resilient level by sleeping, staying hydrated, building good social connections. Social connections are very important. And then making sure we're eating anti-inflammatory diet and do stress reducing activities. All together, all of these things help to keep migraine pathways deactivated by mind, body, spiritual approaches as well. Your body would unlearn to have migraine until you get into major stressful situations. Reduce your to-do list and analyze how much pain and suffering it is causing you. Learn to say no when you need to. I really hope this helps, and I wish you well on your healing journey.